the CEO who hiked life-saving drug prices. Martin Shkreli's scheme. When a pill that cost mere dollars yesterday becomes a luxury, only the privileged can afford today. Lives hang in the balance. We're then left to wonder, is this the American dream or the American scheme? In a world where pharmaceutical giants reign supreme, we often find ourselves at the mercy of white lab coats and stoic boardrooms. And in these rooms, decisions are made that affect every fiber of our being. For the single mother in Idaho, or the college grad in New York, the trajectory of their lives might just be swayed by a man they've never met. Martin Shkreli. For many, the name is synonymous with Pharma Bro, a term dripping with as much sarcasm as disdain. However, to understand the problem, we need to dive deep into its roots. The U.S., for all its innovation and progress, has a healthcare system that many claim is broken. Skyrocketing medical bills, high insurance premiums, and yes, the ever-inflating drug prices. A paradox indeed. For a nation leading in medical research, yet having its citizens ration insulin or skip doses because their wallets can't keep up. While the industry has its fair share of defenders, pointing to R&D costs, inflation, or the complex dance of supply and demand, Shkreli saw something else. An opportunity. The kind of opportunity that makes you wonder, why didn't I think of that? Yet, when that thought pertains to hiking the price of a life-saving drug by over 5,000% overnight, most of us would shy away, but not Shkreli. Daraprim, a drug used for a parasitic infection, was priced at $13.50 a pill. But under Shkreli's turing pharmaceuticals, it shot up to a staggering $750 per tablet. Let that sink in. From the cost of a quick lunch to nearly immense rent in some cities for a single pill. As the old adage goes, to understand the artist, you must first understand his canvas. And in Shkreli's case, his canvas was the sprawling, sometimes convoluted, landscape of American healthcare. Between 2008 and 2015, drug prices increased by an average of 8.5% per year. Quite the tidy sum, especially when compounded. Perception is a funny thing. On one hand, you had Sarah, the single mother in Idaho, holding onto her child's prescription like a lifeline, hoping it wouldn't break her modest savings. Enter David, our retired school teacher from Wisconsin, a man who once upon a time bought his medication without a second thought. But by 2015, he was making the heart-wrenching choice between buying pills or ensuring a decent meal. No one should have to make that choice. But the sad truth was, David wasn't alone. Amidst this juxtaposition, our dear friend Shkreli wasn't just an outlier. He was a symptom, a manifestation of a system that allowed the scales to be tipped so drastically that one man's profit could override a nation's health concerns. Shkreli's introduction to the world of big money wasn't through medicine, but through the high-stakes universe of hedge funds. If hedge funds were the wolves of Wall Street, young Shkreli might as well have been the cub that growled the loudest. By his early 30s, he was already managing millions in assets, maneuvering through financial waters with the agility of a seasoned shark. By the time he founded Turing Pharmaceuticals in 2015, he was no stranger to the game. After all, this was a man who once helmed Retrofin and was adept at turning older, often overlooked drugs into shiny profit engines. Now, when most of us think of breakthroughs in pharma, We dream of miraculous cures or innovative treatments. But Shkreli's genius, or audacity, depending on where you stand, was different. Why waste time and money on research, trials, and approvals when you can buy existing drugs and simply charge more? And so, with the acquisition of Daraprim, he pulled off his piece de resistance. Overnight, a drug that was as old as Elvis Presley's jailhouse rock went from costing $13.50 to a whopping $750 per pill. That's a 5,556% increase if you're counting. Or roughly the same percentage as buying a loaf of bread one day and coming back to find it priced like a diamond necklace the next. News travels fast, especially when it's dripping with outrage. Well, when an NBC report highlighting the unconscionable Daraprim price hike hit the airwaves, it was like striking a match in a room filled with gasoline. The story exploded. The drug, once known primarily to clinicians and patients suffering from toxoplasmosis, was now a household name. Shkreli might have expected some pushback, but surely he didn't anticipate the tsunami that came crashing. Senators tweeted their disdain. Doctors lambasted the move. And the general public, oh, they were in full torch and pitchfork mode. The hashtag Pharma Bro became a trending beacon of collective anger and mockery. Now, to be clear, while Shkreli's pricing antics were morally questionable, they weren't illegal per se. But as the Securities and Exchange Commission or SEC began to delve into Shkreli's past, particularly his time at Redrefin, they found a web far more tangled than the public could have imagined. Remember the hedge funds Shkreli once managed? Those dandy old funds that led him into the world of pharmaceuticals. Turns out, they weren't as straightforward as one might think. Allegations arose of Shkreli using Redrefin's assets to pay off his hedge fund debts. In December 2015, our dear Pharma Bro was arrested on securities fraud charges. Hiking drug prices to sky-high levels was, while undeniably despicable, not the main reason the law came knocking on Shkreli's door. It was, rather, a series of financial maneuvers involving his old hedge funds and Redrefin. The allegations were that Shkreli essentially played a game of financial whack-a-mole, using Redrefin's funds to pay off debts from his floundering hedge funds. He was accused of taking from the corporate to feed his own financial misadventures. In 2017, after a drama-filled trial that could rival any courtroom TV show, Shkreli was convicted on 3 of the 8 charges of securities fraud. While he was found guilty of defrauding investors in 2 hedge funds and conspiring to manipulate the stock of Redrefin, he was acquitted of stealing $11 million in assets from Redrefin. As Shkreli adjusted to his new, decidedly less luxurious digs in prison, the world outside was undergoing a transformation. The Shkreli saga, in all its unflattering glory, had inadvertently triggered a systemic shakeup in the pharmaceutical industry. Laws were being drafted, regulations tightened, and a new era of transparency was, slowly but surely, dawning. For all his bravado and calculated moves, Shkreli was a product of the environment that both created and eventually condemned him. His conviction was not just a verdict on his actions, but a commentary on an industry and a society that allowed such behavior to thrive. Pharmaceuticals, at their core, exist to better and save lives. Thus, this industry stands at a crossroads, with stricter regulations, increased public scrutiny, and a demand for ethical practices. Companies are forced to reevaluate their business models. The legacy of Martin Shkreli will be remembered not just as a tale of one man's descent into infamy, but as the spark that ignited a demand for change. As new players rise and old giants adapt, one thing is clear. The age of the Pharma Bro has ended, but the era of accountability has just begun.